Dr.
I mean,
Jess.
I actually saw that transition happen in the 1960s and before. We had our GP or family doctor. Okay.
Mm,
Now, for those of you in my age group, you remember the TV program Marcus Welby, MD. He
mm-hmm,
was the quintessential family doctor, and his assistant was Dr. Kyle, the younger man who, you know, basically trained with him. And he knew everybody. He knew everything and he would send people out to specialists when it was necessary. And I saw this with my own GP when I was young. Dr. Siegel, he knew everything, and he also knew me, and he knew my parents and knew my grandparents. You know, he's the guy that came to your house when, you know, you had 103 fever and all that kind of stuff that we lamented we don't have anymore. And by virtue of that, when he would send you to a specialist, the specialist would barely talk to you and say, I'll call your doctor. Your specialist will call your doctor. Your
yeah,
doctor will call you and say, this is what the specialist said. This is what I think we should do. And that's what you listen to. And you had the comfort of knowing that you had an advocate,
mm-hmm,
that he knew what he was talking about, and he'd never steer you wrong. The 1970s happened. I literally watched this happen where instead of going into general practice, there was a shift towards specialties. Okay. Now I'm not even going to get into the rationale of it because, so instead of being a GP, the GP got ostracized. You have to be a specialist. That's all well and good, except no one was coordinating.
yeah,
So you go to an orthopedist, or you go to a internal medicine doctor, or then somebody who especially treats diabetes. And the system changed around so that